First is check if they are breathing. Look, listen, and feel for breath. If they are not breathing, call 911. And last, give chest compressions. Calling 911 while beginning CPR is crucial because it ensures professional help is on the way. Improve the chances of survival, allow dispatchers to guide you through CPR, and helps with emergency coordination. It gives the person the best chance to live.
Step first aid for a laceration or deep cut. First, make sure to clean your hands with an alcohol or water. It is to prevent infection before touching the opened wound. Next, if you have the gloves with you, it is way better to wear it before touching the open wound or the laceration area. As you can see, I am wearing both hands, and that is to prevent infection for the wound. Next, inspect for a foreign object in the wound area. It can be removed manually by hand or using the pickup forceps. Check it thoroughly and remove it slowly from the open wound. As you can see, I am taking it slowly, piece by piece. After checking and taking all those objects from the wound, take an sterile water to clean the open wound. Clean it slowly and clean it properly. After making sure that the wound is clean, take an sterile bandage to cover it or a dressing. It is used to protect the wound from any infection. After covering it with an sterile bandage, put a firm pressure on the bleeding part. It is used to stop the bleeding. It is essential in severe bleeding wounds. They could need a medical or surgical management like suturing or administration for medication that control bleeding. Make sure to check their pulse and bring them directly to the nearest hospital.
Hi everyone, today we're gonna do over how to do the Heimlich maneuver. So we need to do this when somebody is choking. A lot of times they start off by putting their hands over here. So just showing that they can't breathe. So what we're gonna do is get behind the person and we need to locate where their belly button is and go a few inches above it. Like 2 or 3 inches, and then make a first around it and then put your hand and grab it tight. Then we're gonna do like inward thrust a few times or 5 times. Then we check the patient. Hopefully whatever was stuck in their throat comes out and this should be good.
Hello everyone, good day. My name is Olympio William Mordila from Malaybalay, Bukidnon, Section 1826, Secondary Major in English first year. Today I will show you how to treat sprained ankle. Let's go!
The first thing we should do is wash our hands
and use alcohol if available. Then we will apply the rice method. So we will put ice packs or a cold compress for 15 or 20 minutes at a time. And every 2 hours, usually during the first 24 or 72 hours, do not apply ice directly to the skin. So next steps, wrap the ankle with an elastic bandage to help reduce swelling and provide support. Ensure that the bandage isn't too tight. And then after wrapping, you should elevate the ankle above and level of the heart as much as possible using pillow to wrap it. And over-the-counter pain relieves the range of motion exercise. Gentle exercise such as alphabet written with the toes can help restore flexibility and range of motions as the ankles start to heal. Strengthen exercise as the pain subsides. Begin a strengthening exercise such as a heel raises and calf stretches to reveal ankle stability. So, with the physical therapy, for more severe pains of recover slow, and physical therapists can provide specialized special exercise and guidance.
Good day everyone. For my part of our topic in first aid, I'll be discussing an important health emergency: heat exhaustion and heat stroke. With the hot weather we often experience, it's essential to understand the signs and how to respond properly. If someone shows signs of heat exhaustion, move them to a cool or shaded place immediately. Help them lie down and give them cold water to drink, only if they are fully conscious. Loosen their clothing and use cloths or fan to lower their body temperature. If they don't feel better within 30 minutes or symptoms get worse, call for medical help. It is really good that we know the difference between heat exhaustion and heat stroke. Heat exhaustion is body's response to losing too much water and salt through sweating. There are common signs include heavy sweating, weakness of fatigue, dizziness, headache, cold veil, and clammy skin. Heat stroke, on the other hand, is much more serious and a medical emergency. It happens when the body can no longer control its temperature, and there are signs included confusion or altered mental state, nausea or vomiting, hot, red, dry or damp skin, rapid and strong falls, or possibly unconsciousness. For heat strokes, don't wait. Call emergency services right away. While waiting, do your best to cool down the person, move them to shaded area, use cold water or ice packs if available, especially on the neck, armpit, and groin. Do not give them fluids if they are unconscious or confused. Remember, early action saves lives. Recognizing the signs and giving the right first aid response can make all the difference. Stay safe, stay cool, and always be prepared.
everyone, I am Marcel B. Dilima, and today I'm gonna share you on how to do a first aid when there is a person that has a broken bone. In saving the life of others, you don't have to be professional to save a life. Broken bone requires medical attention. If the broken bone is the result of major trauma or injury, call local emergency number. When there is a person that has a broken bone, be sure that don't move the person except if necessary to avoid further injury. Don't try to manipulate or realign the bone. Support the injury by their hand or use occasion items or clothing to prevent unnecessary movement. And apply ice packs to limit swelling and help relieve pain. Do not apply ice directly to skin. Wrap the ice in a towel, a piece of cloth, or some other material. Place a padding around the injury for extra support. To support the broken bone, use the technique of triangular bandage or sling. Again, do this when there is a person that has a broken bone. Number 1, call a local emergency number. Number 2, apply ice packs to limit swelling. Number 3, support the injured limb to prevent unnecessary movement. And last one is continue supporting the injury until the person receives a medical help.
Good day everyone, my name is Risadin Baluka from section 1A to 6. Today, I will show you and teach you how to provide first aid to someone experiencing a seizure. So guys, whenever you encounter someone having a seizure, the only one thing you can do is stay calm and don't panic so that you can focus on helping them. So here's an example of what you do. If you see someone having a seizure, then they are lying on the ground, do not try to stop the seizure by restraining a person or replacing anything in their mouth. The only one you can do, immediately turn them onto their side, left or right, and remove any nearby objects that could hurt the person during the seizure. Stay with the person until the seizure has ended and they are awake and alert again. That's all everyone. I hope you learned from the basic method, and most important is your composure and presence are what's needed to help others.
Relax.
Hi everyone, today I'm going to show you how to properly give first aid for a nosebleed caused by a minor injury. It's a common situation and knowing how to respond can make a big difference. So I have here with me is my daughter and she will be my partner for today's demonstration. First thing to do is to stay calm and help the person relax. Encourage them to breathe through their mouth. Step 2 is to position person. Have the person sit down and lean slightly forward. This position prevents blood from going down the throat, which can cause coughing or vomiting. Step 3 is to pinch the nostrils. Use your thumb and index finger to pinch the soft part of the nose, just below the bone. Maintain the pressure for about 10 to 15 minutes. They will help stop the bleeding. Step 4 is to maintain position and avoid movement. Make sure the person stays in this position and doesn't tilt their head backward, as this can cause blood to flow down the throat. Encourage slow breathing. If the bleeding doesn't stop, we can apply a cold compress. You can use an ice pack or a face towel with an ice. So applying a cold compress or ice pack across the bridge of the nose can also help constrict the blood vessels and slow down the bleeding. Once the bleeding has stopped, ask the person to avoid blowing their nose for a few hours. This will help prevent the bleeding from starting again. Always remember, stay calm. Have the person lean forward, pinch the nose for 10 to 15 minutes, and apply a cold compress if needed. If the bleeding doesn't stop after 20 to 30 minutes, or if it's caused by serious injury, seek medical attention immediately. Thank you for watching. Stay safe and remember that knowing basic first aid can help save a life.